So ADHD, in broad terms, it's a neurodevelopmental disorder. One is born with it. But it's a neurodevelopmental disorder which affects particularly the parts of the brain which are involved with the higher executive functioning. For example, things around your attention, things around inattentiveness or dysregulation of emotions, problems with organization, time management, and hyperactivity. Now, all these different domains of impulsivity, inattention, or hyperactivity could present in different ways dependent on the age of the individual, dependent on the gender of the individual at times, or perhaps around the different life stages. I mean, ADHD for a large part, of its history has actually been always thought of as predominantly a childhood disorder, or perhaps predominantly seen in boys. And if you think around the general understanding of ADHD from a few decades ago, it was thought of as a childhood disorder which is seen in boys, and there was an idea of this highly disruptive individual within the classroom. Now, that may be true in the rare case, but more so, it's actually the presentations vary. And over the last probably about 1 decade or so, there has been an increasing focus on adult ADHD. We do know from research that about 55 to 60% of individuals who were diagnosed, or perhaps not diagnosed in childhood, but had ADHD symptoms as a child, they continue to have those ADHD symptoms as an adult. The issue then becomes is that those ADHD symptoms, perhaps due to role modeling or perhaps due to the expectations around adults, how they behave in society, change their presentation, leading to either a misdiagnosis or perhaps an undiagnosis of adult ADHD. In fact, if you look at the European Consensus Statement on adult ADHD, it actually states that adults with ADHD frequently struggle in getting an appropriate diagnosis, or they may end up being diagnosed with another psychiatric condition. The reasons could actually be multifactorial, but predominantly, if you think around, adults develop various coping mechanisms. For example, somebody who has struggles with organization or time management may end up becoming very obsessive about it or very rigid, that they might have multiple apps on their phone, they might have multiple diaries or organizers. Individuals who struggle with focusing may end up with different job changes until they find a job where they're able to manage. So there is a lot of coping mechanisms and masking involved, but also clinicians may perhaps view these symptoms of ADHD not in terms of the ADHD symptoms, but perhaps view it as the impairments which they're causing. To give you an example, the inattention, distractibility, and impulsivity are just what you see at the top of the iceberg. Below the ADHD iceberg, you would see problems with relationships, you would see problems with continuous time management issues, organization problems, problems around their impulsivity and impulsive spending, issues with relationships or multiple job changes. All these struggles could perhaps lead to affective disorders like depression or anxiety, and hence they may get labeled with another psychiatric condition and be viewed and tried treating them as depression or anxiety, which obviously would not lead to a complete resolution of their symptoms.